Penn State Health is always finding ways to better their facilities and their patient relationships. And for those struggling with inflammatory bowel disease, it's no different. Here's a look at the center.
Here at the Penn State Hershey Inflammatory Bowel Disease Center, we strive to be a national and world leader in the clinical care of patients with inflammatory bowel disease. Related to that is the research that's involved in trying to understand the pathophysiology of that disease, as well as doing research that will further our aim of finally finding a cure for inflammatory bowel diseases. The advantage of the Penn State Hershey Inflammatory Bowel Disease Center is that all of the caregivers necessary to care for these very complex patients are under one roof. We effectively can see them very quickly, and frequently patients are seen both by a gastroenterologist and a surgeon at the same sitting. There are numerous other subspecialists readily available in the same vicinity so that any patient who has any form of complication can be seen almost immediately in order to implement a care strategy for that individual patient quite quickly.
Well, joining me now is the man you saw in that video, Dr. Walter Koltun. Also here is patient Rachael Hayes. What is inflammatory bowel disease? How many people does this affect?
Inflammatory bowel disease is a condition of the gastrointestinal tract that usually results in bloody diarrhea, belly pain, difficulty with nutrition. It affects somewhere between 1 and 2 million people in the United States. That number is variable because there are many different types of inflammatory bowel disease, and depending upon how you define it, the number goes up and down. It most commonly affects people in the prime of their lives, in the age category of 20 to 40, and so it's quite a debilitating disease for people who are really just hitting the best parts of their lives.
I mean, when it's time to come see a doctor, like, what kind of approach do you take with the patients? I know you recently opened a new center.
Yes, we have the Inflammatory Bowel Disease Center at Penn State Hershey now. The concept behind that is that patients with inflammatory bowel disease don't just have gastrointestinal problems. This disease can affect their joints, their eyes, it can affect their nutrition, it can affect a woman's fertility, for example. All these various specialists, instead of having to be visited by patients from office to office, these specialists are brought under one roof so that the patient comes to one place, and depending upon what care they need, they see all those doctors or some subset of them at one place on their terms. It's just a very much more convenient, patient-centric way of caring for patients with this illness.
Well, speaking of patients, you are a patient. Tell me about your experience, Rachael.
So I was diagnosed 14 years ago. Actually, next month will be 14 years. I've had a lot of struggles. I've had multiple surgeries for various reasons, all related to the disease. And, you know, honestly, as hard as it's been sometimes, I really am thankful in a way, because it's driven me to be where I'm at today, working in the health field, and it's allowed me to now start the support group and give back to the Penn State Hershey Medical Center for everything they've done for me.
Well, tell me more about that support group.
So I started the support group, I think it was about 3 years ago. The group is amazing. We have different providers come in and talk about just different things about the disease and treatments, and the group, you know, we talk about various ways to cope, and, you know, we bounce ideas off of each other and how to deal, and we've all become very close friends.
That is really cool. It's so nice to see a smile on your face. I mean, you've been through a lot, but you have that smile. What kind of advice or encouragement can you give them?
I think attitude is everything. You know, if you want to feel better, you have to believe that you're going to get better. And then also trusting your team. I mean, I trust Dr. Koltun. He's partially the reason why I'm sitting here and doing so well today. And then, of course, you know, the other gastroenterologists and the other nurses that have participated in my care. You have to trust them.
Very good.
I think one of the things that we do at the IBD Center as well is not only do we have a lot of doctors, but we try to teach patients about their illness so they become part of the healthcare team, because being an educated patient, an educated consumer of healthcare in this regard, really makes a difference in how patients do with their illness.